This is an instructional video for post-op strengthening, especially just after you've had surgery and we can't put much weight through the lower leg and especially the knee. We tie a piece of elastic to the base of the bed and then we put it around the foot. Just note when I'm putting it around the foot, I do it in a loop knot. So not just putting this over the foot, but make sort of a slip knot. Send this through here, and then as it tightens, it pulls and holds onto the foot. Otherwise it tends to come up and down. You can see the tighter it gets, it tends to lock onto your back. We're going to do 150 straight leg raises, like so. Make sure the knees are nice and straight. You can do them in sets of 10. Make sure the knee's not bent, but completely straight. 150 sideways, like so. Come to the end of the bed and make sure the elastic is strong enough. Sometimes I pivot to this one, to a yellow piece of Decathlon elastic, because it's a bit tighter, and it will be 150, 0 to 30 degrees. So I don't want it going all the way down. 0 to 30, the emphasis here is on the knee straight. We get to do 150 full straight. Hold it for 2 seconds in extension. It really turns on the VMO. 150 there. I find on a good solid hard bed, along those lines, if you've got a day bed and it's quite high, sometimes getting a little bit higher for these can be quite useful. Sometimes people, if they've got a low coffee table, a really solid coffee table that's quite low, and just putting a towel on it can also be quite useful. If the bed's soft, you may want to do it, say, on the big coffee table or something like that. A good solid kitchen bench is also not a bad, it's just trying to get up onto it, but there's some options. We use a piece of elastic. If you're partial weight bearing, we can get you to start doing elastic around the feet. Stay on your heels, and we get you to do 3 minutes using a kitchen bench because it's about the right height. Give me some support. Sideways walking, you'll feel this in your glutes. As you get a little better, up onto tippy toes, and then this is again 3 minutes. And the other thing is, as you start to get a little bit more comfortable doing this, you put a bit more weight through your lower legs, you can let go with your hands. 3 minutes forwards and backwards as well. And notice, start off on your heels and you can then go up onto your toes as you feel more comfortable and balanced, and let go with the hands. Once you've had surgery, so those set of exercises, we'd like you to do them at least twice a day. The other option, the other thing I would like you to do on an hourly basis for knee surgery will be to put a piece of paper underneath a foot and a shoe on. Every hour you will be straightening, bending the knee to 90, straightening, bending the knee to 90, 100 repetitions, and after the 100 reps, you can do some straight leg raises. And often here, if you want to produce even a bit of force to make it harder, you can also just push down a little bit, or just do these without pushing, and you'll turn on the quad. So that 100 here and the 100 here is once every hour. That's all for the initial part of your rehabilitation.